Hello, my name is Brett Hiring. I'm the pharmacy manager with BJC Home Infusion. Today we will discuss the process for performing your infusion utilizing your IV access, TPN or hydration, and CAD pump. In the video, I will be referencing a TPN bag, though if you are ordered hydration, the procedure is the same but may not include any additives. First, we will identify a clean, non-cluttered surface to lay out our necessary supplies. Next, we will collect our supplies. We will need at least 1 saline flush, 4 alcohol pads, 4 AA batteries, our CAD pump, CAD tubing, and our medication. It is best to remove your TPN from the refrigerator 3 to 4 hours prior to your dose to allow it to acclimate to room temperature. Now that we have all supplies laid out on our work surface, we are ready to replace the batteries in our pump so that we start our infusion with a fresh set of batteries. Turn the white knob on the top of the pump. Remove and discard the old batteries. Replace with 4 new AA batteries. Next, we will perform hand hygiene. To do this, we will wash our hands with warm water and soap for at least 30 seconds. It is important to work up a good lather and properly clean all surfaces of your hands, paying attention to get spaces between fingers and under fingernails. It is best to utilize paper towels to dry your hands, as dish towels can harbor bacteria. If you do not have access to a sink and water, it is sufficient to utilize an alcohol-based hand sanitizer, as long as your hands are not visibly dirty, though the hand sanitizer must be at least 60% alcohol to be effective. To utilize hand sanitizer, we will place a dime to quarter size amount in the palm of one hand. Utilize the same procedure as hand washing. Make certain to cover all surfaces of both hands with the hand sanitizer. Again, paying attention to get spaces between fingers and under fingernails. Then allow the hand sanitizer to fully dry. Now that we have performed hand hygiene, we will put on gloves and are ready to begin preparing the medication and CAD pump for administration. If you have additives for your TPN, such as vitamins, we will add those first. For instructions on this process, please refer to our video on TPN additives. Once we have placed the additives in the TPN bag, we will then spike the TPN bag with the CAD tubing. Remove the tubing from the packaging. Then, remove the dust protector on the tubing port of the TPN bag. Remove the plastic spike protector from the tubing, taking care not to touch the spike. Next, spike the TPN bag. Make sure to advance the spike all the way to the shoulder of the spike to ensure a good seal. Next, push the power button on the right side of the pump to turn the pump on. The pump will sound a series of 6 audible tones that signify the startup check was successful. With the pump powered on, select Task. Then select Reset Reservoir Volume. The screen will display the reservoir volume to be reset. Select Yes. Now, obtain your bag or cassette of medication. To load the new cassette on, first make sure that the silver lever on the right side of the pump is pulled down. Now, place the 2 hooks on the left side of the cassette onto the 2 metal bars on the bottom left of the pump. This will create a hinge point. Now hinge the cassette into place, moving the square peg on the right of the cassette into the square hole on the bottom right of the pump. It is easiest to hold it in place by placing the cassette and pump on a solid surface, such as a table. Maintain pressure on the pump and move the silver lever back to flush with the pump. This will lock the cassette into place. Check to make sure that the lock mechanism is properly engaged. The screen will then ask if you would like to prime the tubing. Make certain that the tubing is not attached to the patient, then select Yes. The pump will begin priming. Allow the pump to prime until a few drops come out of the end of the tubing. Then select Stop Priming and then select No that you do not want to continue priming. We are now ready to begin the SASH protocol for medication administration. Get an alcohol pad. We will now scrub our catheter access, or scrub the hub, with alcohol. It is important to wrap the alcohol pad fully around the threads of the needleless connector and scrub vigorously for 30 seconds. Allow the excess to dry, then connect your saline flush. We will then unclamp the pinch clamp on our access. Now we will flush our line using a pulsating flush to ensure that the catheter is functioning properly. If you note any increased resistance to flushing or are unable to flush your access, first, ensure that the pinch clamp is fully opened and that there is not a kink in the line. If you are still having difficulty, contact your infusion provider for further assistance. Once we have flushed the access with saline, we will clamp the line. Disconnect the saline flush. If you have more than one lumen on your catheter, take this time to also flush your other lumens with saline and heparin. Next, get another alcohol pad and scrub the hub for at least 30 seconds. Allow the needleless connector to dry completely. Remove the cap from the end of the CAD tubing and attach to the needleless connector. Select Yes to start the pump. The infusion of your medication has now begun. During the infusion, the fluid level in the bag will decrease. Check on the device intermittently during your infusion to ensure that it is operating appropriately. When the infusion is complete, the pump will sound an audible alarm and the bag will be nearly empty. Press Silence, then select Acknowledge to stop the pump. Clamp your IV access. Prior to disconnecting the infusion, we will again perform hand hygiene. After performing hand hygiene, we will don a pair of gloves. Then, we will disconnect the tubing from the needleless connector and get an alcohol pad and saline flush. Scrub the hub for at least 30 seconds and allow to dry. Once completely dry, connect a saline flush. Unclamp the IV access and flush utilizing a pulsating flush. Clamp the IV line and disconnect the saline flush. Get an alcohol pad and scrub the hub again for 30 seconds. Allow the needleless connector to dry fully and then connect a heparin flush. Unclamp your IV access and flush with heparin utilizing a pulsating flush. Clamp the IV line and disconnect the heparin flush. If you have more than one lumen on your catheter, take this time to also flush your other lumens with saline and heparin. You have now completed the process for administering your TPN utilizing the CAD pump. Things to be mindful of during this process. Always review your medication label instructions prior to each infusion to ensure correct administration and that you are infusing the correct medication. Always make sure to perform good hand hygiene prior to each infusion. Remove your TPN from the refrigerator 3 to 4 hours prior to your dose. Times when you should contact your infusion provider. If your catheter is not functioning or allowing you to flush it. If your occlusive dressing has become wet, dirty, torn, has blood beneath it, or is coming off. If you are running a temperature greater than 100.3 degrees Fahrenheit. If you begin to develop a rash or itching at your dressing site or anywhere else on your body. Any pain, swelling, redness, or warmth in the arm where your IV access is placed. Any onset of diarrhea or changes in bowel habits.